So when I see a patient with knee osteoarthritis, and let us say this patient is overweight or obese, we talk about weight management options and also the importance of exercise for improving one's fitness. So studies show that 1 unit of weight loss has been equated to 4 units of reduction in knee joint forces. This is huge, highlighting the importance of healthy weight in patients with knee osteoarthritis. So when I tell them this, my patients get really motivated in order to get started exercising. But at the same time, sometimes they feel helpless on how to exercise with bad knees. So in this video, I'm going to give you some tips on how to exercise with bad knees. And at the same time, I'm also going to give you some tips on how to lose weight. I promise. So the general public recommendations for exercise volume and intensity is going to be 150 to 300 minutes of moderate intensity exercise, or 75 to 150 minutes of vigorous intensity exercise, or a combination of both. Along with this, you should also perform strength training at least minimum of 2 times per week. Now let us talk about aerobic exercise first. So the goal of any aerobic exercise is to stress the heart in a controlled fashion. So basically you're doing an activity that tells your heart to pump oxygen to the working muscles. The only difference is that when you have knee arthritis, the exercise should have a low impact on your knees. So studies show that a land-based exercise such as walking, as well as aquatic exercise such as swimming, has been shown to improve pain and function. So this is a good news. So let us say if you're walking and the walking does not aggravate the knee pain, then you're fine, right? You can start walking as a mode of exercise. But I still wouldn't recommend getting all your exercise minutes just by walking alone, unless you've been doing that for months together and you've been feeling fine. So for people who are starting out, a good tip would be to start 10 minutes of walking daily and then supplement with other modalities of exercise that can be easy on your knees, such as elliptical, biking, rowing, or swimming. The reason you want to start slow with walking, even though it's a good aerobic exercise, is that you should let your knee slowly adapt to the joint forces. So this is why I tell people to start slow. So maybe 10 minutes of walking and add 2 minutes of walking every week. So it may take anywhere between 3 to 6 months to get to 30 minutes of walking, and that's totally fine. So sometimes too much walking, especially in people with overweight or obese, they can develop what we call as bone stress fracture. So basically the bone gets stressed too much, and that can increase risk for stress fracture. And when someone develops a stress reaction, which is kind of just a bony swelling, or they develop a stress fracture, then it can become a barrier to exercising regularly. That's why prevention is the key. So let us say if your knee is not tolerating even slight amount of walking, then if you have access to pool, then you can start walking in the pool, and as you can slowly build your muscle strength, you can transition to land-based exercises. So please make sure to include knee strengthening exercises at least 2 to 4 times per week. And I've attached a link at the end of the video to start the knee strengthening exercises right away. So in addition to that, I would recommend adding core exercises to a strength training workout. So how about, let's say you enjoy running and you're asking if you can run if you have knee arthritis. So my advice would be, let us say if you're running and then after running your knee feels fine, then it's okay to continue running. But at the same time, I still would say that, let us say if you're running 150 minutes per week, then I would recommend cutting by 50%, so maybe like 75 minutes per week, and then supplement with low impact exercise modalities like we talked about. So remember, exercise alone cannot help with weight loss. I tell patients that if you take 5,000 steps, you burn around 300 calories. Nowadays, 300 calories is nothing. So for people who are starting out to help with weight loss, here is an easily achievable tip. Number 1, no high calorie foods after 4 p.m. Number 2, eat at least 5 servings of vegetables and 2 servings of fruits daily. Number 3, quit sweetened drinks. And number 4, fast for at least 12 hours. I hope this video was helpful. If you want to know more about the treatment of knee osteoarthritis, then click the link here. If you want to get started with knee strengthening exercises, then click the link here. And I'll see you in the next video. Until then, goodbye.